In this case, Spanish and English.
I was just going to say, because if you have another generation, they probably...
Yes. So we need to check that out. We need to, because the kids insisted on speaking English, and so we would always check with Mama whether or not she was understanding, whether she was following what the kids were saying, and if necessary, we would interpret.
How long does a program usually last for a family member? Let's say somebody comes in, has again, not a typical problem, but a problem. Is it a 6-month program? Is it 3 months? How long does that take, and is there any follow-up on that?
Yeah, we just have some data on that.
Yeah. One of the strengths, I think, of the program is that we have shown a trend that's a little different than what normal data shows, and that's that Latinos don't stay in treatment very long. The dropout rate is very high. One of the things that we found, based on some research that we're doing, is that our numbers are much higher. So we do have probably a large chunk of our clients that stay for 9 to 12 sessions. Now that can be over a long period of time because they don't all necessarily come in every week, and that's the norm. So you have some that stay for 30 sessions, some that stay, and that can be anywhere from 6 months to a year. So really, I think that's one of the benefits as well as of a program like this, that we don't have a set time.
It's pretty customized.
I think that's true of the entire counseling center, is that we don't pre-decide. Nobody's telling us, no insurance companies, no government, nobody's telling us how long this person can be in treatment. And that's always decided between the client and the clinician together. And so they may come in with one goal, that they get resolved, and other issues come up, and they don't have to just stop. They can say, I want to continue to work on this, or, oh, I thought this was going to take a long time, but I feel great now, and can I come back in a month if I need to? And so it's a very collaborative experience between the client and the therapist.
Now, what is the cost of something like this? Will someone not call because they think, well, this is going to be a big chunk out of our family budget? How do you deal with that? I mean, it's an obstacle to overcome, obviously, when somebody does call.
It's an obstacle. It seems to be more for us. We have a sliding scale fee plan, and it's based on the client's ability to pay. So there's a chart that tells how many family members there are and how much income there is, and then we figure out a fee. And then we have a scholarship committee. The Institute scholarships the difference between what the client can pay and what the standard fee would be, which would be about $60 an hour. But that's the standard fee. Our average fees probably run around $20 an hour or less. And I have to tell you, I've been there 10 years, and in the 10 years I've been there, we have never turned away a client, even when they couldn't afford the lowest rate. We worked out a way to provide services for them.
So how does that compare to like your for-profit kind of establishment? What is the difference? If you're charging between 20 or 60,
one clear difference.
If I go to Beverly Hills, how much would they charge them?
Yeah, well, not so much in terms of difference in cost, but the opportunity it offers us to be able to work with the family in a variety of ways. This mother was talking about, clearly the kids need to see someone as well. So now we have the opportunity to be able to have some of the counselors work with the mother, and separately have other counselors work with the kids, because the cost is low, and then we have that option to be able to address the needs of the whole family.
So how many clients do you have on a typical basis?
In the Latino family therapy, or in the whole?
Well, let's take the whole program and then Latino specifically.
I think we see about 200 clients a week at the center. And then we are, as I said, in 20 LAUSD schools with about 30 therapists that are in those schools, and each of those sees a number of children. So that's probably another 200 children that are seen a week. Plus we're in 2 probation camps out in the San Fernando Valley where boys 13 to 18 have been sent, and they have little or no counseling services there at all.
Oh, really?
And we started a program there probably about 8 years ago that I started, and we're still there, and we see probably, I would say 20 boys a week or more, 20 to 40 boys a week individually, and more than that if we count the groups, because we do a parenting group for them, we do an anger management group, and we do a substance abuse group for them also, and that's throughout the year at 2 different camps. And so probably close to 800 clients a week, I would say, between all the different things we do.
That's a lot of clients. Now, do you have enough people to take care of all these clients?
Yes. As I said, when I first came here, we had about 40 therapists on staff. Now we have about 100 therapists, plus our licensed therapists.
Now, you're looking to expand, and if you are, how are you going to expand the program?
I'd love to expand in some different ways. I'd like to go out to more schools.
Right.
I'd like to provide more facilities where we're actually looking for some homes for the elderly with the population, the aging. We're trying to provide more training in that area for our therapists, and we'd like to find more sites, assisted living facilities that will allow us to come in and provide group and individual therapy. And the other thing I'd like to work on, which is part of the way we're growing in this world, is how do we provide services where the client needs them? Not every client can come to your office.
Right.
So that's why we go to the schools and the camps and the elderly facilities. But also I'd like to provide some services if we had more funds to support us, because we are a nonprofit, and at less than $20 a session, you're barely sort of scraping by. If we had some funds, I'd love to provide services for people that are homebound. People who can't get to where we are.
Now, getting to your funding, where do you get most of your funding? Obviously, the $20 or $60 that you charge for these services is not going to cover it. So, where else do you get your funding?
Well, we really write to foundations. We try to get foundations. The California Endowment has funded our doctoral program to train doctoral students how to work with Latino students, to Spanish-speaking students to work with the Latino populations. That's one big funder that we've had, and in fact, through them, we are going to be having a symposium October 1st, where Angie and Jose Luis will be presenting their findings on how do you train folks to specifically work with Latino populations, and maybe they can talk a little bit about the symposium.
Is that the first time you've had this kind of symposium, or?
Yes.
And where's it going to be?
It's going to be at the LA Marriott, and it's actually a pre-conference to the Latino Behavioral Health Institute conference that they have annually.
And who's the conference for specifically?
Clinicians, primarily mental health providers. We don't get a whole lot of actual clients.
Students.
But there are some students, just different programs.
What's the capacity for this conference? How many people can...
It's the biggest conference that attracts health and mental health professionals and students and providers in delivering services to Latinos. It's the biggest one in the nation. So the co-sponsors are county, state, and federal government, federal agencies. So the three-day conference attracts close to 1,000. Yes. Mm-hmm.
And from all over the state or all over the country?
All over the state.
Okay.
Yeah.
And now, what will be discussed there? What are some of the things that you will be covering?
One of the things that we will be doing is offering a variety of workshops where we're going to be talking about the experiences we've had working with Latino clients, so that others learn from the experience, some of the things that how we've trained and how we've served couples and families and working with children, and just pass on that knowledge and that experience to those that would like to do the same.
In fact, they're actually preparing a full manual that will be given to all the participants who attend their full pre-conference day on October 1st. Where they're really going into the details of how they provide training for these people. What is it like to train them in Spanish for supervision and training, and this live supervision they do, which is very unique, where they actually see a client behind a two-way mirror, and the students actually watch the treatment, and they come in and make interjections and comments to help the therapist, and they're going to be showing how they do that specifically with the Spanish-speaking clients and training these. And they'll be given a manual that they can replicate the model that we've created at.
Now, do you have a specific model that's not been used before? Is something that's sort of a template for other organizations to follow? And
exactly. There's several components of the training model that we have for those that want to provide clinical services to Latinos. And just the fact that our case discussions and the supervision is in Spanish, and that promotes the confidence within our students to use Spanish, and to learn Spanish and to kind of apply the more technical use of Spanish in our profession. the observational that Sandy was talking about, where students get a chance to observe each other and get direct feedback, direct supervision is another aspect of it. So there's several components of our program that we want to share with the professional community.